Turning 60 is not just another birthday. It represents a major internal shift inside the body, especially in how the heart responds to stress, aging, and medications. Many seniors feel fine on the outside, but inside, the heart becomes more sensitive and less forgiving. Heart doctors around the world are raising concerns, not to create fear, but to prevent silent damage. Their warnings are meant to protect seniors before problems become serious. Awareness, at this stage of life, is one of the most powerful forms of protection. This video is about understanding risk, not panicking. It is about asking the right questions at the right time. And most importantly, it is about helping seniors live longer, safer, and more confident lives. Why heart health changes after 60. As we age, the heart muscle slowly becomes stiffer and less flexible. Blood vessels lose elasticity, which can affect how efficiently blood flows through the body. These changes are natural, but they also make the heart more vulnerable to extra strain. At the same time, organs like the liver and kidneys, responsible for breaking down and removing medications, begin to slow down. This means drugs can remain in the bloodstream longer, increasing their impact. Even medications that were once well tolerated may start behaving differently. Heart doctors emphasize that aging does not mean weakness. It means the body needs more careful balance. What was safe at 45 may need reassessment at 65. The problem with common medications. When people hear drug warnings, they often imagine rare or extreme medicines. In reality, many heart doctors are concerned about common, everyday drugs that seniors use regularly. These medications feel familiar, routine, and safe. Some are taken for pain, inflammation, sleep issues, or general discomfort. Others are used for long-term conditions. Because they are common, their risks are often underestimated. The danger is rarely sudden. It develops slowly, quietly, and over time. This is why heart doctors are urging seniors to pay attention before symptoms become severe. How certain drugs can stress the heart. Certain medications can cause fluid retention, forcing the heart to pump harder. Others may slightly increase blood pressure or interfere with heart rhythm. In younger bodies, these effects may be manageable. In older adults, however, these same effects can place extra strain on an already aging cardiovascular system. Over months or years, this added workload can contribute to heart complications. Doctors often explain it simply: the medication itself may not be the problem. The combination of the medication and an aging heart is where concern begins. What medical research shows? Medical research consistently shows that adults over 60 experience more medication-related complications than younger individuals. These include irregular heartbeat, dizziness, swelling, fatigue, and worsening heart function. Studies also highlight that seniors are more vulnerable to drug interactions, especially when taking multiple medications at once. This condition, known as polypharmacy, significantly increases cardiovascular risk. Heart specialists emphasize that these risks are preventable. Regular review and adjustment can dramatically reduce harm and improve quality of life. Why this issue is often overlooked. Healthcare systems are busy, and doctor visits are often short. Medications are frequently renewed automatically unless a major issue appears. This creates long periods where drugs are taken without reassessment. Many seniors trust that if a medicine helped before, it must still be safe. Unfortunately, the body continues to change even when prescriptions remain the same. Heart doctors warn that routine without review can quietly become dangerous. Silence is often the biggest risk factor. A real-life scenario many seniors relate to. Imagine a 67-year-old man who has taken the same medication for years. He lives independently, stays active, and feels mostly fine. There is no obvious reason for concern. Gradually, he begins to feel more tired. Walking becomes slightly harder. He notices swelling or breathlessness but assumes it is just aging. In many cases, these subtle signs are early indicators of medication-related cardiac stress. Without awareness, they often go unrecognized. Why heart doctors are speaking up. Cardiac specialists often see patients only after serious damage has occurred. Over time, patterns emerge, and certain medications appear repeatedly in patient histories. These doctors are not blaming medications. They are advocating for smarter, age-appropriate use. Prevention, they say, is far easier than treatment. Their message is clear: seniors deserve proactive care, not reactive crisis management. Medication interactions, a major hidden risk. Many seniors take multiple medications daily. Each additional drug increases the likelihood of interaction, especially in aging bodies. One medicine may slightly raise blood pressure. Another may affect heart rhythm. Together, they can amplify stress on the heart. Heart doctors strongly recommend regular medication reviews to identify and reduce these risks before problems arise. A global senior health issue. This is not a problem limited to one country or healthcare system. Across the world, populations are aging, and medication use is increasing. Reports from multiple regions show similar trends in medication-related heart concerns among seniors. This makes awareness universally important. No matter where someone lives, the aging heart responds in similar ways. The need for caution is global. What this video is not saying. This video does not encourage stopping medication suddenly. Abruptly stopping drugs can be dangerous and should never be done without medical guidance. It also does not replace professional advice. Instead, it encourages informed conversations between seniors and healthcare providers. The goal is understanding, not fear. Knowledge leads to safer decisions. Smart steps every senior should take. Heart doctors recommend that adults over 60 request a full medication review at least once a year. This review should consider age-related changes and current health. Seniors should report subtle symptoms like fatigue, dizziness, swelling, or shortness of breath. These signs matter, even if they seem mild. Asking whether dosages are still appropriate can make a significant difference in long-term heart health. Seedling the role of lifestyle in heart protection. Doctors agree that lifestyle choices play a major role in supporting heart health after 60. Daily movement, balanced nutrition, and stress control strengthen the cardiovascular system. Gentle walking, light strength exercises, and relaxation techniques help the heart function more efficiently. These habits support the body alongside medical treatment. Lifestyle improvements do not replace medication, but they often reduce strain on the heart. Stress and emotional health. Chronic stress increases blood pressure and inflammation, both of which affect heart health. Emotional well-being is closely connected to cardiovascular stability. Seniors who maintain calm routines, social connections, and mental engagement often experience better heart outcomes. Heart doctors emphasize that peace of mind is not a luxury, it is a protective factor. Empowering seniors with knowledge. Aging does not mean losing control. It means adapting wisely. Seniors who stay informed are better equipped to protect their health. Heart doctors speak up because they see the difference awareness makes. Early action preserves independence and dignity. Knowledge replaces fear with confidence. Key takeaway message. The greatest risk after 60 is not age itself. It is unquestioned routines that no longer fit the body's needs. Regular review, open communication, and mindful living protect the heart far more than silence. Your heart deserves attention, care, and respect at every stage of life. If this video helped you understand heart health after 60, please like and share it with someone you care about. One share can make a real difference. Comment below if you or a loved one has ever reviewed medications later in life. Your experience may help others. Subscribe for calm, science-based senior health guidance focused on safety, independence, and dignity.